Hi, Jackie Van Ruler. In today's video, I'm going to be talking about ear infections, what you can do to prevent them, and also to treat them once they've started. The best course of action is the second you get the first symptom to do this. Once it's set in, it's much harder to get rid of, and so it takes a lot more work and effort. But the first time you get that first symptom where you feel kind of stuffy, where you feel, maybe some pressure in your ears, this is where you want to do this. If you are not already signed up or following me on my Instagram page, I do post these face maps to my Instagram page as well. You can do that at Jackie Van Ruler. And with this video, we are going to be using SalonPas Pain Relieving patches. These are little patches that have menthol and camphor in them. They do also contain a little bit of aspirin, so you just want to use them sparingly, but they look like this. And then what you're going to do is just cut them up into little pieces like this. We really just need to put those pieces on the areas that feel stuck or stagnant. And we're going to use the magic wand, which is a facial reflexology detector, to detect the areas that feel stuck or stagnant. So those stuck and stagnant points are telling you where you have a lack of flow within your body. So we're going to start with our kidney points. The kidney is the organ that's most associated with the ears. Every organ system has a specific sense organ that they're associated with. So you're going to put your fingers on the corners of your mouth, bring them all the way up to the hairline from there, come down a little bit, and you're feeling for a spot that's maybe about a centimeter down or so. It feels like your fingers will kind of fit into it. Those are your kidney areas. I'm going to feel here on the right hand side. And this one doesn't feel super stuck or stagnant, so I'm not going to put a sticker on it, but if yours do, you will want to. And as I come over here to the left side, it doesn't feel super stuck, but I am feeling like there is some resistance to me working on it, so I am going to put a patch on there. You can do this on children. Children move energy faster, so you don't need to work each point quite as long. Next point I'm going to do is right between the eyebrows, and this is a point for the pituitary gland. Pituitary gland is really good at just balancing all your hormones, all your body functions, and particularly your stress response. Okay, that's feeling pretty open and clear for me. I'm not going to put a sticker on it. We're going to come into the sides of the bridge of the nose right in here, and this is a point for the throat, the thyroid, and the tonsils. So I'm feeling in there. I don't have an ear infection, so I'm not expecting that a lot of these are going to feel super stuck or stagnant, but if you do, you're probably going to feel a lot of them feeling pretty stuck and stagnant. I'm not feeling too much there. And then I'm going to come down, so right here, kind of underneath that inner corner of the eye, this is a point for the sinuses. You might feel like you have some good pressure in there if you have an ear infection, just because you're going to have some pressure and congestion everywhere. I'm not feeling too much there. Coming to the other side. Feeling a little bit there, so I'll just go ahead and put a patch on there. With these, you want to make sure you don't get too close to the eye, because this is very spicy. It might make your eyes water. Okay, then we're going to come to right underneath of the nose. This is a point that warms up the body. And I also just like having these patches right underneath the nose because you're inhaling that menthol and that camphor. That helps to kind of clear things out. And I'm feeling it again on the left-hand side, but not on the right. And you might notice that yours are more congested into one side, either right or the left-hand side, just like mine is. And you might find that it's on various sides, so it can be different each time that you do these routines. Then I'm going to come in and work point 17, which is right in here, and 38, which is halfway between the nose and the mouth. So right in here. This is an immune system point, so this is like a natural antibiotic point. And I'll come in and work this point, which is the adrenal kidney point as well. So it's a second kidney point. And these two together are really good for decreasing inflammation. I'm not feeling any spots there, but I can almost guarantee you that if you have an ear infection, you're going to feel in one side at least of 0.38 is going to be very stuck and stagnant. Feeling a little bit over here. And yeah, just a little bit on 17 for myself. So I'll just go ahead and put a sticker there. Again, I'm not sick, so I normally would just wouldn't use the sticker so much. Coming underneath of the mouth, this is a diuretic point, so helping you to get rid of extra fluid and inflammation. Right in here. Again, that feels okay on me. Right in here. Then I'm going to come down to the middle of the chin. This is for the bladder, so again, helping to get rid of extra fluid and inflammation. And that feels good for me. And then we're going to work all around the ears. This is probably going to be the most important area that you do. In fact, you can even start with doing this area. So working at the top of the ears, this is going to relax the shoulders, allowing fluid from your head and your face to move through the shoulder area. Coming down this front side of the ear, working down it slowly. This might feel really good. It might be really tender in here. So just working this whole area. Coming out right in front of the earlobe is another point for the throat. So working that area. This might feel very stuck and stagnant in here. This is a lymphatic drainage passageway, so helping you to get rid of extra fluid, inflammation, and congestion in the ears. And then coming up, working all the way around the back side of the ear, coming down that front side of the ear. You might be working this area several times during the day, just because it'll feel good to try to get things moving. Another thing I highly recommend if you're prone to ear infections or you get them frequently is taking something like cod liver oil. Those fat-soluble vitamins, especially vitamin D, is really important for the kidneys to keep them nice and healthy. So cod liver oil is a really good thing that you can do to help to boost your immune system and support your kidneys, and thus supporting your ears. So again, starting at that top of the ear here, working your way slowly down. And then I would highly recommend once you put these SalonPas patches on, working 14 here in front of the earlobe for the throat, is to go take a nap. So put them on, go take a nap, lay down, let your body do its thing while it's resting. The ears have to do with the kidneys, and the kidneys really respond well to rest, to relaxation, to deeper meditation and things like that. So anytime you can get really good sleep, it's going to really support your kidneys. All right, be sure to let me know how this feels after you're doing it. Let me know if it helped you with your ear infection. And of course, if you have a very serious ear infection, you will probably need antibiotics, but if you can get it at the very, very start of when things are going, you can probably avoid the antibiotics and the other stuff that's not so good for your body and can actually lead to more future ear infections too. So definitely don't resist getting treatment if you already have something that's set in. But if you're just feeling the very beginning stages of it, do this a couple of times first and see if you can just knock it out before anything sets into your body and gets worse. Thank you for watching, and I will see you in the future. Thank you.